that's Andy, isn't it?
Yes.
You know, Dr. Andy. Dr. Andy is a pain specialist here in Tulsa, and he's got a very interesting story that makes him a particularly powerful ally of the autism community here in Oklahoma. So Andy, tell us your story.
Tell us your qualifications first of all. I'm really interested.
Well, I'm a MD trained physician in anesthesiology with a subspecialty training in pain management. My wife is also an MD trained physician and then a residency in psychiatry. And we have a 16-year-old autistic son. 16-year-old to this day of this interview. He was born 16 years ago today.
And what was his story? He did normal early development?
A completely normal development. We were at the time both residents. My wife became pregnant. She went into labor, delivered him via C-section. Completely normal APGAR scores, all the developmental milestones, perfect. He got his normal immunizations that were the schedule in the year 2000, and then got 12-month immunizations as well. And then we began to see strange behavior, regression, less eye contact that was present before, and he began to slowly regress and slip away. And when we moved to Tulsa right before his second birthday, we thought he was a clever lad. He would know letters and numbers and be very into that. And then all of a sudden we realized, he wasn't interacting with peers, he wasn't looking at us, he was acting in a stranger way. And my wife, being a psychiatrist, had heard of autism, which was very rare and something you read in page 500 of a psychiatry textbook in the day, but now all too common, sadly, and in the common lexicon.
Tell me about those 12 months, just go back to those 12-month shots. What did he receive at the time? Do you remember?
Well, he would have received whatever the schedule was at the time, and my wife could tell you more specifics, but he got everything in the hospital and everything at 12 months. Okay. So he got the varicella at the time, MMR, the DPT, all the vaccines that were recommended both at birth and age 1.
Right. Okay, and did he get many on the same day? Do you remember whether he...
Yeah, he got them traditionally the same day.
Okay.
And my wife also received the flu vaccine and RhoGAM during pregnancy. So she had an additional mercury load back in 2000, even before he was born.
Okay, so you've lived this nightmare. Your wife was very special at medical school. She did well, is that right?
She finished third in our medical school class. She was a psychiatrist, which was a passion of hers. And when we moved here to begin both of our careers, it became apparent during his diagnosis that there was no way she could work full-time or even part-time as a physician and take care of this child, because he had regressed, he had bowel issues, he had the classic type of diarrhea. We tried special diets, but he had regressed to the point where we were given the diagnosis of autism spectrum disorder.
Okay, so she was third in class. She was a very smart, talented physician, and she's never actually been able to work as a physician because of the damage done to your child.
That's correct. She's never worked one day since his diagnosis.
So an extraordinary talent completely wasted.
Well, and I think an extraordinary talent on two parts, because both hers and what potential talent my son would have had that will never come to bear either.
Of course.
How is your son today? What are we looking at?
My son today is verbal, but not conversational. He cannot have any social interactions. He has made some progress, but cannot live independent and will not live independent.
Do you have other children as well?
Yes, he has an 11-year-old brother.
Okay, and was he vaccinated?
No.
And is he well?
He is well. He's never had one vaccine, one antibiotic. He is a normal, healthy, happy 11-year-old, never had an ear infection, doesn't have any allergies of any kind.
He's what a young boy should look like.
He's what a young boy looked like when I was a young boy, when we never saw peanut allergies, when we never saw these particular things. He's a young boy. He's the young boy we used to have before we, I think, as a society, poisoned our children.
Yeah, I think you're absolutely right.
Can I ask a quick question? In the profession that you're in now, how does how do your colleagues react when you tell them the story of what happened to your son?
Well, you know, I think many of them follow the party line and see it as no causal link. I mean, they know our personal story. They know what we've been through in 20 years of marriage and with a 60-year-old son with this type of problem. But, you know, we are the outliers. And certainly we're considered sort of on the fringe. But then I find a lot of my colleagues and associates who, while expounding the party line, are reticent to follow the recommendations for their own children. You know, when they're born, then they have questions, and then they begin to delay and modify the vaccine schedule and say, well, why does my newborn need a hepatitis B vaccine when that was only something that you got when you started medical school because you were exposed to blood-borne virus? And so they follow the line until it hits close to home, and then it's suddenly not as cut and dried as they want to make it.
Not as cut and dry, and in truth, in the back of their mind, they know what's going on. I think many of them actually know what's going on.
I think they do. I think they do, and I think, you know, what we've seen in our local organization and with other concerned parents, be they physicians or not, is that there's an intuition out there. There's a sense that something is going on out there. When you never used to see autism before, when it was on page 500 of my wife's psychiatry textbook, and now it's as ubiquitous as, you know, red wine. You know, there has to be something there, and I don't think you can write it off as an anomaly. You can't write it off as overdiagnosis. I think mothers, parents have an intuitive sense that somebody's trying to pull something over on them, and we're not getting the true full story.
Okay, well.